Hey, it's Dr. Troy here, the Vancouver Chiropractor at Zenaptic Chiropractic, home of the Charging Rhinos. Today I want to talk about fulcrums and spinal molding. A lot of patients ask me, hey, how do I do spinal molding? And so if you've gotten a spinal molding wedge from us or a Dental, here's what you want to do. First thing I always recommend when you're new at this, start out laying on your bed. Eventually you could graduate to the floor. It's going to be a firmer surface. But this could be pretty intense for you. We're going to put this under your neck. This is the one for the neck. The ones that you have probably are going to be gray, but these are blue ones. They're covered in plastic, which is fine. I've had these for a long time, so I'm using these. But there's also a little wedge here. One way you could lay on it is in the wedge. The newer ones have a bigger cutout here, but I recommend laying on the neck one this way. And then we have the low back one, which looks a little different. The top is chiseled off here. So this is for your low back or your lumbar wedge. Now, how do we use these? Patients always go, what do I do? I say, well, your goal is to get up to 10 to 20 minutes a day on these. I had a patient recently, she said it hurt. After 30 seconds, I had a lot of pain. I said, stop. So tomorrow, go to a minute. So if you could go 3, 4, 5 minutes and it starts to hurt, stop, you're good. The next day, try to add a little bit more time. Now, people who have like numbness in an extremity, like sciatica, carpal tunnel, I encourage them to do the wedges 4 to 5 times a day just for 1 to 2 minutes. The more frequency we have to decompress the spine, the disc, the nerve roots, the faster healing and the better resolution we're going to get of the issues that are going on with the spine. So let me show you how to do this. This one goes to the neck, this one goes in the low back, and first things first, I would recommend we put this one here and lay back like that. And then you put your neck. I recommend putting the neck one down as far as you can. So we just lay on these things. So this one goes right about your hip waist height and lay there. Now, I always encourage people to leave their legs up when they first start. If you put your legs down, it's going to be more of an intense stretch. Also, if you think about this, if you do ab exercises and you don't have a wedge, now your spine's going to be flat. And so you're strengthening a flattened spine, which is not ideal for strength. This way, when you do an ab workout, you actually have the curve in there. So just something else to consider. But there's different movements you can do on these to help mobilize your spine. You can go side to side with your legs to help mobilize. You got to go gentle though. When you first get up, it's a little hard to do on the bench, but when you're on your bed, I would recommend just taking them out really slowly, really slowly. Don't do any sudden movements because you really just stretched a bunch of soft tissue. And then I would recommend getting up very slow on your side, push yourself up so that you don't exacerbate anything because you're really making big changes when you're using the wedges. So if you ever have any questions, feel free to ask me in the office. I recommend doing these every day, especially when you're in a lot of pain. A lot of patients, I'll ask them, hey, you been wedging? They're like, no. But when they flare up, they're pain motivated, so they get their wedges out. The wedges will last you a long time as long as your dog doesn't get a hold of them and chew them apart. But I've had these blue ones, I've had these for over 15 years. My wife wrote a little note on the side here, love you, honey, when we first got married. So I've had these almost 15 years. So they last forever, and they're very inexpensive, under 40 bucks for the set, so that you can do decompression. We can mail them to you, or if you're in the office, we'll get them to you in the office. So if you have any questions, feel free to call me. Feel free to email me, Dr. Troy at Zenaptic Chiropractic, or you can call and get a consultation with us, 360-260-6903. Thanks for listening. Make sure to do your wedging.